Okay, thank you. I'm really, really pleased to be here in this very distinguished group of speakers and audience. And thank you, Frank, for those nice words. I'm here representing the consumer. I have been a hearing aid consumer since 2002. I wear a hearing aid now in my right ear and a cochlear implant in my left ear. I wear them all day, every day. I wouldn't have a life without them. But we have come a long way since the first days of hearing correction, but we still have a long way to go. That guy on the right probably looks very familiar to many of you. As Frank has said and studied, only 1 in 7 people who could benefit from a hearing aid wears one. And we all, I think, have a pretty good idea why this is. Cost, the perception that they don't work very well, and the stigma of age. I agree with the first two. Hearing aids are incredibly expensive and they're not reimbursed by insurance most of the time. And they don't work well for many, especially in noise. But I disagree about age. This is a NIDCD graph which shows you that about 2/3 of people with hearing loss began to lose their hearing before the age of 60, mostly in the decades of 20 to 59. I lost my hearing originally when I was 30. And then Frank just showed this graph, which is why I think we think that hearing loss is for the elderly. All those people who get hearing loss in the earlier decades add up to about 80% of people over 80 having hearing loss. And so it's very easy to understand why we equate the two. But I think as a consumer, this is important because I think this reinforces the stigma of age. And if we could realize that hearing loss affects people of all ages, I think we would all be much more likely to wear hearing aids. People often ask me what hearing loss sounds like, and I can't say generically what hearing loss sounds like. I can only say what my hearing loss sounds like. I think we all experience hearing loss in different ways, depending on the degree and the nature of the loss, the kind of correction we have, the kind of person we are, and the relative difficulty of the challenges in our daily hearing environment. Uncorrected, my hearing loss sounds like this. It's actually peaceful. It's lonely, but it's peaceful. But when I put in my hearing aid implant and people start talking and cars start going by, it sounds a lot like this. And it gets louder and louder and louder. Still, I wear it anyway because when it's quiet, I can hear birds chirping, I can hear a stream gurgling, I can hear a friend talking, I can hear so many things that I can't hear anything without my devices. So they're essential to me. Even though we all hear differently, there are common elements in the way we experience the onset and progression of hearing loss, and I want to talk about 2 of these here today. The first is that all but the most resilient people, when they experience hearing loss, especially sudden hearing loss or serious hearing loss over a period of time, can find it really emotionally devastating. We grieve the loss not only of our hearing, but often of our way of life. Hearing loss affects how we work. It affects our enjoyment of music and movies and lectures, our relationships with family and friends. And for many, including me, that emotional reaction begins with denial. My hearing isn't that bad. I don't need a hearing aid. I'm sure you've all heard that. I did that for 2 decades, more than 2 decades, actually. In 2002, after more than 20 years after I was given a diagnosis of a fairly severe loss of my left ear, I got a hearing aid. I got 2, in fact, because by then I couldn't hear in my right ear very well anymore. I did not give up denial at that point, though. I was sure my ENT would find the cause, would manage to reverse the progression of my hearing loss. The cause of my hearing loss is undiagnosed. I began researching hearing loss myself, delving into my health history, hoping for a clue. And instead, my hearing just continued to drop inexplicably and infuriatingly, and so did my spirits. I sank deeper and deeper into depression. In 2008, I lost the minimal remaining hearing in my left ear and most of the hearing in my right ear as well. I isolated myself increasingly at work. I worked at the New York Times. And with friends. I avoided the cafeteria. I avoided meetings I should go to. I never went out for drinks afterwards with people. The low point for me came a little bit later. No, actually, it was during that period, 2008, the night of Obama's first election. I watched the election returns alone at home on my couch. I told my friends I couldn't come but watch with them. I drank too much and I fell asleep before I even knew that Obama had won. Always accompanying this depression, there was anger. There was anger at my hearing, anger at my colleagues, anger at my husband. I was short with my kids. I was estranged from my friends. I was angry with the hearing aid industry for not coming up with better products. I was angry at my audiologist for not being able to make me hear again. I was angry at science. I was angry at the world. The following year, I got a cochlear implant, but mine was not a joyful eureka experience, as other people have described, unfortunately. All that negative stress made it very hard for me to adjust to my cochlear implant. And so did years of neglect. I could not get an implant in this ear until almost the time I did, because FDA regulations prohibit it because I could hear in my right ear. So my left ear was basically deaf for 30 years before I got my cochlear implant. So I got the cochlear implant, was activated in October, and by the end of the year, I left my job, which I loved. Despite the cochlear implant and the hearing aid, I really couldn't do that work, and I wasn't interested in doing the work that was offered as a substitute. So by now it's January of 2010. I was out of work. I was deaf. I really was at rock bottom, and the only way to go was up. And anger actually helped, surprisingly enough. Anger was my original incentive for writing Shouting Won't Help, the book you saw the cover of before. I thought, I'll show them what I've been through. I'll show them all how badly they treated me and how unsympathetic they were. Fortunately, I moved on. That's not a good premise for a book. And as I researched hearing loss and as I got to know a lot more people with hearing loss, I gradually was able to put it into perspective. And eventually I reached in this familiar graph, which I'm sure you all know about, that elusive stage of acceptance. I was able to accept that hearing loss is part of who I am. Because I write and speak about hearing loss, it's a big part of who I am, but it's by choice. I own my hearing loss. My hearing loss doesn't own me. That doesn't mean that I don't have occasional fits of what Gail Hannon, the blogger, calls ear rage. Hearing loss is always there and always ready to trip you up. The second thing I want to talk about is the hearing aid marketplace. I think most consumers find it incredibly frustrating. One reason people don't get hearing aids, I think, is because they don't know where to begin. They don't know what kind of hearing aid to get, where should they buy it, how can they afford it, do they need an audiologist, how do they find a good audiologist? People ask me these questions all the time, and I say, I don't know. I'm a writer. I'm not an audiologist. Go to your doctor. Go to an ENT, have your hearing checked. They'll give you some references. But people are really, really confused about how even to take the first steps. I had a very good audiologist recommended by my ENT who guided me through the maze. But even now, I'm not sure where I've been or how I got here. My first pair of hearing aids back in 2002 cost $6,000, which was a major bite out of my salary. And when I applied for insurance reimbursement, I actually did get something, $500. For 2 hearing aids. With subsequent hearing aids, I was turned down flat, not a cent, and I did get 3 more pairs of hearing aids after that. It's really, to me, no wonder that so many people turn to the big box stores or the internet for their hearing aid purchases. We're a do-it-yourself country when it comes to consumerism, and we shop where we can get the best bargain. So I think we have to acknowledge that the internet and the big box stores are part of the hearing aid community. I think, though, that what we can do is to make sure that bargain comes with a good audiologist. My audiologist, just for those of you who haven't worked with audiologists, my very, very good audiologist spent hours and hours and hours with me over the years. My hearing would seem fine in the acoustically ideal environment of her office, and then I'd walk out on the street and I'd be assaulted by street noise. The speech would sound imprecise or be fuzzy. In the real world, I'd go back, she'd fix it, I'd go back. And still, I always heard too much of what I didn't want to hear and not enough of what I did want to hear. Sometimes my hearing aid itched. Sometimes it was too tight. I don't know how it would get tight and not tight again, but it did. I'd take it back. She'd shave it off or adjust something or send it back to the manufacturer. And each time I got a new hearing aid through her, she did what I think all audiologists should do, is that she immediately scheduled 3 follow-up appointments in that first 30-day period, and to readjust and reprogram the hearing aid. Often that wasn't enough, and I still had to try a different brand because my hearing is complicated and not very good. And above all, she stuck with me cheerfully through these many, many years of hearing aids. I am sure that I was far from her least cost-effective patient. But even this paragon of audiology had lapses. She didn't explain that getting the most from a hearing aid takes practice and patience. She didn't refer me to a hearing loss support group like HLAA or ALDA. She didn't tell me about our rehab programs available on the internet like LACE. None of my hearing aids had a telecoil until 2 years ago when I specifically asked for one. This isn't unusual. 40% of hearing aids today still do not have telecoils. She did offer me a variety of hearing assistive devices, most of which I turned down. It was just too much stuff, too much to deal with. Finally, I bought the ICOM Bluetooth for use with the telephone, and it worked as long as I was in a quiet place. But as I quickly realized, I was now at the mercy of my cell phone provider. You can't make a call unless you have cell phone service. Even when you do make a call, there's a lag, the natural lag of the cell phone, but also I think an additional lag from the Bluetooth. People say they can't hear you, which I always found very ironic since most of the time I can't hear them. Generally, though, the phone continues to elude me, even with all the devices I have. A year ago, my son called. That is not my son. My son's an adult. And I had no idea who it was. He kept saying, "It's Will." And I kept saying, "You want to talk to Will? He's not here." Now, at least, I think I would finally recognize that it was Will, even though I might not hear what he was saying. And I, like many people with serious hearing loss, rely on captions, which are fine. I won't say more about that. 2 years ago, I got an FM system. Also from the same audiologist. It's much more versatile than the ICOM. It can be synced like the Bluetooth to your cell phone. You can also use it in personal conversations, holding it out to somebody. You can put it on the podium at a lecture. The first time I used it for any sustained period of time was on a trip I made to China, and the guide wore it. And it was fabulous. I heard everything he said in crowded marketplaces, in museums. I was just absolutely thrilled with it. But the controls, I don't know how to use. The one on the left is what I wear. That's the receiver. And the one on the right is the transmitter, which is worn by the speaker or put on the podium up here. The controls are all on the device that goes up here with the speaker. And that doesn't make any sense. It's me, the listener, who needs to be able to change those controls. There is a small volume control on my end, but there's not a way to change the program. There's not a way, if I'm somehow on the wrong channel, to change it. I'm not about to walk up to the podium and start fooling around with it in the middle of somebody's speech. Also, this ICOM device has many moving parts, 4 obvious ones, 2 devices and 2 chargers, but also all sorts of things inside. And one of them, alas, always seems to be broken. It connects to the phone, but there's no sound. Someone talks into it, but I don't hear it. I plug it into the TV, and that mutes the TV, so my husband can't hear it. But finding out why it doesn't work involves the busy audiologist again. And actually, and generally weeks and weeks of waiting while one part after another is sent back to the manufacturer. My hearing aid is sent back to see whether it's the T-coil. And then a few days after I get it home and it's all working again, it stops working. I've been going through this actually for almost the entire time I've had my device, but I went through it especially this past fall, and over the Christmas break I spent a lot of time fooling around with it myself, and I discovered that the one part that hadn't been checked was the charger for the transmitter. So the transmitter was charged when I was in the audiologist's office because she'd plugged it in, but it wasn't charged at my house. No wonder I wasn't hearing. Luckily, by now, I have come to know the Phonak rep, and she agreed to send me a new charger. And at the moment, I have a working FM system. And that model is not one that is used in the hearing aid industry, that direct-to-consumer model. But it's what the implant companies do routinely. I know my rep at Advanced Bionics, and now I know my rep at Phonak. Thank you, Natalie, for providing this quick fix to my FM system. It's far, far more efficient. I don't understand why it isn't done in the hearing aid business. Meanwhile, I just want to say that I have a Bluetooth in my car that connects to my phone automatically and effortlessly every single time. So there's something there with room for improvement. In the past couple of years, I'm not going to talk about this. I just want to show you this picture. This is a photo of my bedside table on that trip to China with my chargers and my equipment, which, as you can see, probably needed their own suitcase. I do wonder why it's not possible to make something more like a universal charger. Every charger is different. In the past couple of years, I have experienced looping, which is another hearing assistive device. It's amazing. I hear better with looping than I've heard in 40 years. I don't have to buy a single extra piece of equipment to access it, and I don't have to carry around any chargers. I don't have to put anything around my neck. I don't have to put anything on my head. It's great, but it can't solve all our problems, and I think we really, looping advocates, need to remember this. You can't use it if you're profoundly deaf, if you can't or don't wear a hearing aid or an implant. You can't use it if you don't have hearing aids, except by putting something around your neck, a loop listener. You can't use it if you don't have a telecoil, and as I said before, 40% of hearing aids still don't have telecoils. You can't use it mostly if you don't know the loop is there. This loop sign, these are two variations of it, should be displayed like that, both inside and outside the venue. The Gershwin Theater in New York, where Wicked is playing right now, is looped, which is great. But you cannot find out that information anywhere on their website, in their ads, even in the fine print of their website where they talk about devices, assistance for the hearing impaired. Looping is not mentioned anywhere. I think the biggest problem for now is that in this country, very few venues have installed looping. Consumers don't know what looping is, and so they don't ask for it. And if they don't ask for it, they don't get it. Juliet Sturkins from Wisconsin, who's here somewhere I know, has personally been responsible for installing a lot of loop systems in Wisconsin. And she has a mission to have a loop system installed in every audiologist's office. I didn't know about looping because my audiologist didn't know about looping. And if she did know about it, she didn't care about it, or she hadn't experienced it and didn't realize how useful it would be for me. If she had had a looping system in her office, she could have demonstrated it for me. I might then have gone to my favorite lecture hall and said, there's this great new system, you know, it's going to cost you a few $1,000s to install, but many, many people will benefit. More people will show up. You know, you want more gray hair in your audience, get that looping system in there. I think we would begin to see a lot more movement on this. There's one more thing, is that I personally can't use looping without the backup of CART over there. Here's me giving a lecture in a looped environment, and I had to turn around to look at the CART to see what was said. Somebody had introduced me as a celebrity. That's the other reason I like that slide. We'd all like to be happy consumers, but we're not there yet. And I just want to say a few of the things I think we need. I think first we need standardized best practice protocols on every level. The hearing aid marketplace truly is a chaotic mess. Consumers are overwhelmed by the choices and the cost. Audiologists, social workers, geriatricians, nursing home employees need to understand the emotional toll that hearing loss takes. They need to understand when they are confronted with denial or anger, where that's coming from. And they need to encourage that person to find a support group like HLAA or ALDA, and they need to maybe even encourage the patient to become an advocate for people with hearing loss, turn that negative into a positive. Every audiologist should offer the same minimum checklist of services. Ideally, audiologists should also be able to test hearing aids in a real-world environment. I know that's possible. The whatever it is, downtown Manhattan has one. And it's actually amazing to walk into a room that sounds like the street and see how well your hearing aids work or don't work. All of this would benefit the industry as well, as it would undoubtedly reduce the rate of returns from consumers who haven't been educated about their hearing loss, have not been counseled about the need to practice and to come back in for reprogramming, who have hearing aids that don't fit properly. Hearing aid companies need to get their act together and give us hearing aids that work, even in noise. They need to bring their prices in line with other consumer electronics. I think we're all baffled by why this is not possible. They also need to make assistive devices that work and that are simple to use. Government needs to mandate coverage for hearing aids. The cost of not providing hearing aids is far higher in terms of unemployment and in cognitive decline and dementia than the cost of providing them. You're going to hear a lot about this over the next few days, as Frank said just a minute ago. And finally, hearing aids should be as common, as effective, and affordable, and as unremarkable as glasses. So, thank you.